Alendronate Sodium Solution, Osteoporosis Agents is used to treat certain types of bone loss, known as osteoporosis, in adults. Osteoporosis causes bones to become thinner and break more easily. This medication works by slowing down bone loss, which helps maintain strong bones and reduces the risk of broken bones, also known as fractures. Alendronate Sodium Solution, Osteoporosis Agents belongs to a class of drugs called bisphosphonates. It is taken once a week, first thing in the morning, on an empty stomach, with a full glass of water. Do not lie down for at least 30 minutes after taking this medication. Before taking alendronate, be sure to read the medication guide provided by your pharmacist. It's important to follow the instructions closely to make sure your body absorbs as much of the drug as possible and to reduce the risk of injury to your esophagus. If you have any questions, don't hesitate to ask your doctor or pharmacist. This medication is taken once per week. Choose the day of the week that best fits your schedule and take it on that day each week. Take this medication by mouth, after getting up for the day and before taking your first food, beverage, or other medication. After taking liquid alendronate, drink at least 2 ounces, 60 milliliters, of plain water, then stay fully upright, sitting, standing, or walking, for at least 30 minutes and do not lie down until after your first food of the day. Alendronate works only if taken on an empty stomach. Wait at least 30 minutes, preferably 1 to 2 hours, after taking the medication before you eat or drink anything other than plain water. Do not take this medication at bedtime or before rising for the day. It may not be absorbed and you may have side effects. Calcium or iron supplements, vitamins, antacids, coffee, tea, soda, mineral water, calcium-enriched juices, and food can decrease the absorption of alendronate. Do not take these for at least 30 minutes, preferably 1 to 2 hours, after taking alendronate. Take this medication regularly to get the most benefit from it. Remember to take it on the same day each week. It may help to mark your calendar with a reminder. Talk to your doctor about the risks and benefits of long-term use of this medication. When taking alendronate sodium solution, you may experience stomach pain, constipation, diarrhea, gas, or nausea. If any of these effects persist or worsen, notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they have determined that the benefit to you outweighs the risk of potential side effects. Many people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as jaw or ear pain, swelling of joints, hands, ankles, or feet, increased or severe bone, joint, or muscle pain, new or unusual hip, thigh, or groin pain, black or tarry stools, or vomit that looks like coffee grounds. In rare cases, this medication may cause serious irritation and ulcers in the esophagus. If you notice symptoms such as new or worsening heartburn, chest pain, or pain or difficulty when swallowing, stop taking alendronate and speak to your doctor or pharmacist right away. Although a serious allergic reaction to this drug is rare, seek immediate medical help if you notice symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects not listed here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking alendronate, make sure to inform your doctor or pharmacist if you have any allergies, especially to other bisphosphonates, as this product may contain ingredients that can cause allergic reactions. It's important to discuss your medical history with your doctor or pharmacist, especially if you have any disorders of the esophagus, trouble swallowing, low calcium levels, kidney problems, or stomach/intestinal disorders. Some people taking alendronate may experience serious jawbone problems, so it's important to have regular dental checkups and inform your dentist before any dental work. Before any surgery, be sure to inform your doctor and dentist about your use of alendronate, as they may advise you to stop taking the medication. This drug should not be used in children, as studies have shown severe side effects in pediatric patients. If you are pregnant or plan to become pregnant, discuss the risks and benefits with your doctor, as alendronate may stay in your body for many years. It is unknown if this medication passes into breast milk, so consult your doctor before breastfeeding. Remember to always consult your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. This is important because drug interactions can affect how your medications work or increase the risk of serious side effects. It's a good idea to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your healthcare professionals. This will help them determine the best course of action for your treatment. And as always, follow your doctor's guidance for the proper use of alendronate sodium solution. If you suspect an overdose and notice severe symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, get in touch with a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center. Symptoms of overdose may include severe stomach pain, painful heartburn, chest pain, muscle weakness or cramps, and changes in mental or mood. Always seek medical help if you suspect an overdose. It's important not to share this medication with others. To promote healthy bones, it's recommended to increase weight-bearing exercise, stop smoking, limit alcohol intake, and eat well-balanced meals that contain enough calcium and vitamin D. You may also need to take calcium and vitamin D supplements. It's best to consult your doctor for specific advice. While taking this medication, it's important to have lab and/or medical tests done, such as X-rays, height measurement, and checking blood mineral levels. Remember to keep all medical and lab appointments, and consult your doctor for more details. If you forget to take a dose, just take it the next morning and then continue with your regular schedule. Do not take 2 doses on the same day. When storing alendronate sodium solution, make sure to keep it at room temperature and away from light and moisture. It's important not to freeze the medication or store it in the bathroom. And always remember to keep all medications out of reach of children and pets. When it comes to disposing of the medication, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product and it is expired or no longer needed. It's a good idea to consult your pharmacist or local waste disposal company for the best way to do this. Now, let's talk about the best time to take alendronate sodium solution for osteoporosis. It's usually recommended to take it first thing in the morning, at least 30 minutes before eating or drinking anything, with a full glass of plain water. This helps the medication work effectively and reduces the risk of irritation to the esophagus. And remember, it's important to follow the dosage instructions provided by your healthcare provider for the best results. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.